Hi, my name is Professor Shlomi Cohen. I'm a specialist in gynecology and endometriosis. I work in the unit of endometriosis here in the Sheba Medical Center, and I have a clinic for chronic pelvic pain and neuropelviology. Today I'm going to give you some tips and tricks for early diagnosis of endometriosis. First of all, each woman, each person should believe his pain. The pain is not imaginary. And if somebody suffers from pain and is approaching the medical system, it's a true pain. Nobody is imagining the pain, and the pain severity increases if you don't treat it properly at the right time. So time is very important. So if we meet with a girl who's just having her first periods and she suffers terribly from pelvic pain during the menstrual period or during ovulation or both, it should be treated as suspected endometriosis, and she should be referred to a specialist in endometriosis to help her find the correct diagnosis and correct solution. Another thing is a heavy menstrual period. If this comes along or side by side with the pelvic pain during menstruation or ovulation, that's another sign that insinuates endometriosis. Okay? This pain, this heavy bleeding usually refers to bleeding in the heavy days of the period, which mandates the patient to replace her tampon or sanitary pad in less than 3 hours. If this happens, this is menorrhagia, this is heavy pathological menstrual bleeding, and this could indicate endometriosis. The third, for the more grown-up patients, is the pain during intercourse, which we call dyspareunia. So if a patient suffers from pain during intercourse, this could be also an indication for endometriosis. Other symptoms are involving the digestive systems. So it could be either bloatness in the abdomen. It could be like the endobelly, which a patient feels like as if she was pregnant with a inflated abdomen, but she's not pregnant. And it could be either diarrhea or constipation. Could be pain during defecation, even severe pain during defecation, which we call dyschezia. And all these symptoms are also suspected if they come along with the pain or the bleeding during menstruation, could be also related perhaps to endometriosis. Another thing is the pain that might radiate to the low back pain, which causes low back pain, or to one of the limbs. Some patients have radiation of the pain to the limb in such a manner that they can barely walk during the pain attack, or they might need some crutches to walk around, or they can feel some numbness, or some hot flashes radiating to the leg, one leg or the other side, typically to the right side. And this is also could be an indication of endometriosis. If you're over 12 years old and you suffer from chronic pain during menstruation or ovulation, if you see that you're heavily bleeding and you find yourself using painkillers every month when you menstruate, you should see a specialist, because at least the minimum that you owe to yourself is a recognition of suffering from endometriosis, which will assist you a lot to get to be diagnosed on time and get the appropriate treatment and prevent complications of the disease, which are outcome of negligence and late diagnosis. So you have to recognize that you have the disease, and when you have this consciousness and your awareness in you, you can win. You can win by using the tips and tricks and medications and surgery that will offer to you when needed. But the major thing would be deciding that you have endometriosis, and in spite of that, you can have a healthy and normal life. It's in your hand.